To help us understand the projections, let's turn to Dr. Peter Lynn, our CBC News medical contributor. Thanks for joining us, Dr. Lynn. It's always a pleasure to have you on. Let's talk about the projections that we've seen this week. Despite the numbers, no one seems to know for sure when a pandemic has reached its peak until after it's happened. So let's talk about how helpful those models might be.
Yeah, so basically it's a number so that we can say that it's very serious. So therefore, people that are not paying attention, that maybe not doing the social distancing and the physical distancing, maybe that will sort of shock them into it. And also the people around them will say, hey, you shouldn't be going around to this place and so on and so forth. So I think what it does, it raises the level of concern for everybody with very large numbers of the number of people that are dying. But the projections, like you said, are exactly that. They're just sort of, they took a look at the graph. And then they say, if we continue doing these things, the line will go out this way. If we do these measures, the line goes this way. So therefore, the actual final number is actually based on what we do. And that's why the Prime Minister keeps saying is what we do will alter those numbers that they're projecting out there.
The recommendations we've heard from federal officials about wearing face masks has evolved, shall we say. Now there seems to be the sense that one could wear one to prevent it spreading to other people. Was there perhaps an initial concern that if you said, wear the masks, everybody, that there would be a run on them, as we saw with toilet paper, and there wouldn't be enough PPE, which there still may not be, for healthcare workers?
Yeah, there was two halves of it. In the beginning, it was contained to people coming in on airplanes. So therefore, people were isolated, found out, and then they were cocooned away. So truly, the rest of the public was not at risk because they weren't wandering around in the community. So masks and things like that was not necessary. Two things happened. One is that we started having this spread in the community after we had lots of people coming back from the United States being infected. And we didn't suspect the United States because their numbers were very low because of defective testing and things like that. So what happened was that when the numbers increased in the community, then people started saying, maybe we don't know who we're going to bump into that might have the virus. On top of that, we started learning that you don't have to look sick to shed the virus. So in other words, a couple of days before you get sick, you're already producing lots of virus and I'm breathing it out. And so therefore, if you're within a space, let's say you're sitting next to me or I give you a hug, then I could breathe that same air and pass it to somebody else. So then all of a sudden the mask became useful. But the mask that we're using, of course, as you said, not enough supply. So we don't want people fighting for that. And then so all of a sudden you see the CDC, the Surgeon General saying you can make this out of a T-shirt. Now a T-shirt will not stop the virus from coming in because there's lots of holes. So if you sit next to somebody that's breathing out virus, you will breathe that virus in. So that's why doctors and healthcare workers do not wear a T-shirt when they're seeing COVID patients, right? Because they're going to pick it up. What it does do is it stops your airflow. So in other words, by having all this stuff in front of your face, you can't breathe out very fast. And so therefore, the wind that the virus needs to move, the wind is cut down. So that's why the virus can't move very far in front of your face. And so that's why the mask may be helpful. So that's why you keep hearing Dr. Tam, it stops you from pushing out the virus because the airflow has been cut down. So this thing needs a wind gust. It's like a sailboat. It needs a wind gust to push it forward. And by having that mask there, you cannot push that virus out as far. And that's why it might be helpful to protect people. Now, in a long-term care home, they're wearing the little surgical mask. All the employees are now beginning to do that. In Hong Kong, when they did that and they kept 6 feet away from the patient and they wore the mask, there's been no transmission to a healthcare worker. So therefore, that 6 feet is probably the most important thing. And then the mask can be extra, but that's just to stop you from blowing stuff outward.
A team of blood transfusion experts from across Canada are planning what will be the world's biggest clinical trial of a potential treatment involving antibodies and transfusions. And yet efforts are underway right around the world. Can I get you to talk about this particular therapy that seems to be set to test in Canada?
Yeah, so basically what they're looking at, and they've tried this before in the Spanish flu and SARS, is you take the people that have survived, and if they've survived, it means that they've recovered, they've made the antibodies, the weapon that we can go after this particular virus. So you take their blood, you spin it down, take those antibodies, and you give it to the sickest people that are on ventilators, etc. So in other words, these people that are in an ICU or in a ventilator for 2 weeks, it means that they haven't made those antibodies to fight it off. So lending them the army might be a good idea. And in China, for example, there were 5 patients that they published recently. 3 of them got 5 got treatment. 3 of them were able to get off the ventilator and then go home. So therefore, there's lots of promise. But that was only 5 people. So that's why the Canadian group very quickly pulled it together and said, we need to do this on larger numbers of people so we know how should we do it, are there any side effects, what's the best way to do it, so that the rest of the world can know what to do with their patients as well. The only thing is that in China, what they did was they took the blood and then within the same day, they gave it to the next person. So in Canada, because of geography, we're hoping that we could do that, but it might be, you have to freeze it and then transport it. So that might be the only difference. And then we'll learn whether that freezing does anything to the antibodies or not. So hopefully we will have information that the rest of the world can use as well.
Dr. Lin, you've been invaluable through all this, and you will be again. Thank you for your time this morning.
Thanks, John.
CBC News medical contributor, Dr. Peter Lin.